A great result is the outcome hoped for by anyone seeking plastic surgery. And one of the most commonly requested procedures is the facelift. We sought out one of the most esteemed surgeons in the Coachella Valley, Dr. Mark-Sofonio, to find out more about the evolution of plastic surgery today.
When we talk about facelifts, we really need to talk about three distinctive types of facelifts. The first type of facelift is the most common and certainly was the most common until the mid-'80s. Basically, that's a procedure where the skin is undermined and then pulled back, and it's a skin lift. And this is still a very commonly performed procedure in the United States. The problem with just a skin lift is that we don't alter the underlying architecture of the face. And many times you see patients that will present with very weak necks, a very weak neckline, and heavy jowls, and a skin lift alone is not going to take care of this. And so what we really need to do is then pay attention to the underlying structure, which is the muscle. And there's a muscle, it's called the platysma, and I'm going to go ahead and show it to you. I'm going to go ahead and contract it, and it runs right here. It starts in the clavicle, runs right here, and runs, and it's a muscle unit here, and then it becomes more of a attenuated fascia here, and it inserts right here on the cheek. Well, this is the muscle of the face, and there's one on either side. And with aging, not only do we get extra skin, but we also get muscle laxity. So when a patient presents to us, they probably have both skin laxity and muscle laxity. And a muscle facelift, with a muscle facelift, we pay attention to the underlying muscle structure. And so the more contemporary facelift is one that addresses this issue. And we'll go in and actually tighten the muscle centrally and both on the side, and also release it here and gently advance it in this direction here. So what we get is a facelift where the underlying structures are tightened. And the key there is then we don't have to pull on the skin to get tightening. And so we can just lay the skin back down gently, and voila, the patient has a beautiful result, but they're not pulled, and that's the key. Many times you see a traditional skin lift and the patient will walk around very, very tight because the skin has been used to tighten the underlying structures. And I personally don't like that look. The look I like is where we tighten the muscle and get a very gentle, natural look. So that's the second type of facelift. The third type of facelift is a newer procedure that's been out for several years, and it's basically one that addresses solely this area of the face, the mid-face. And what happens with the traditional skin lift or a muscle lift, even if you pull here, you don't get a lot of advancement in this triangle of the face. So there's a separate procedure called a mid-facelift. And here what we do is we enter through here or through here, and we advance this part of the face. So it's a separate procedure. It's called a mid-facelift. So there really are three types of facelifts when you talk about them. In addition, what I tend to do while I'm doing a facelift is I also address the skin. And I'll tell the patient, well, you've got sun damage, so while I'll surgically treat the underlying muscle and skin, I'll also treat the skin on the surface with a peel or a laser. And that's very common as a combined skin muscle facelift with a laser. And that's the most common procedure we perform, and I think that gives fantastic results.